supporting the journey from childhood to adulthood. And most of us have actually had that journey, correct? And we're all here to talk about that. Or we're still on the journey, right? We're still on that fabulous journey. And I do want to bring you greetings from Star Health, as well as from the University of Delaware's Employee Health and Wellbeing. Again, it is great honor and a privilege for us to host these conversations. And we have a fabulous panel tonight to share with you their findings and then to get into that wonderful art of conversation. I'm going to ask the three of our gentlemen to introduce themselves and talk a little bit about their work, no more than 5 minutes, because we do want to get into the conversation side of it. And now we're going to, who would like to go first?
I was just about.
So Roger, Roger will go first. Roger,
Hi guys. So my name is Roger Harrison, and I'm a psychologist at AI DuPont Hospital. And in my role there, I do two core things. I do a lot of things, but my core jobs, I do psychological assessments. And my psychological assessment service has varied through the years, and so I've done a lot of assessment of like attention, executive functioning, learning. These days, I've been focusing more on mood conditions, mood disorders, and I also work with a population of youth who have questions about their thought functioning, so kids who might be developing like psychotic symptoms. And so I do that, and I also spend the other half of my clinical time working in our primary care clinic, so I work with pediatricians and families, and I do a lot of intervention work with kids all over the spectrum, and that's most of what I do. Teenagers, I have 2 at home. I have a 9th grader and an 11th grader, and another, maybe a 5th grader. I think she's in the 5th grade. That's what I do.
That's great, Roger.
My name is Tim Fowles. I'm a faculty member in the university's Department of Psychological and Brain Sciences, and I kind of wear 3 hats. As a faculty member, I teach graduate and undergraduate classes. I also help run a center I helped create called the Center for Training, Evaluation, and Community Collaboration. Our goal is to get evidence-based, scientifically strong treatments out into the community where they can, benefit families most. And then I am the director of our small training clinic off of West Main Street, where we see clients from the community, everyone from 3-year-olds to 93-year-olds, including teenagers. And last but not least, I also have some of my own. I have an 18-year-old, I have a 15-year-old, and I have a 13-year-old. And so I get to say, wow, this is how you do it by the research, and well, I'm doing terribly at it.
Yeah.
So
exactly.
Research doesn't always play out in practice,
exactly.
does it?
It's easier to read about it than to actually do it.
That's true.
There you go.
That's true. So hi, I'm Frank Newton. I'm Associate Dean here in the College of Health Sciences, so that's one hat that I wear. I am also a father of 2 teenagers, so I have an 18-year-old who's actually a freshman here at the university, and I have a junior in high school. I have served, I've been here at the university for 24 years and worked at a couple other institutions before that. So I have had the luxury and pleasure of advising students who are in that sort of high school to college transition, as well as those students who are, as they like to say, starting to need to adults as they move their way out of the university. So I've advised thousands of those students. The other thing that I do is I am the chair. I've been on the board, and I'm chair of the board of Newark Charter School, which is a K through 12 public charter school here in Newark. And so we see a range of students dealing with issues there. And so I've worked both with the administration, but also with the staff there as well, so to hear about those issues. So
great. So you can see we have a common theme here. Not only are these 3 gentlemen joining us tonight from their professional background, but they just happen to be parents and are on that journey with their children.
So we're looking for answers as well.
That's right.
And looking for answers. So we invited all of you to kind of give us the answers relative to the journey from childhood to adulthood, and what are the challenges, not only for the population, but for those of us who are trying to support and guide the population as they advance in their journey. Also want to make you aware that we want this to be interactive. I will start probing some questions. If anything resonates with you, you'll see in your program there's an area that you can keep notes. There is also, we will have mics that will circulate. Our students are here to support that. So if you would like to direct a question to all of our panelists, just raise your hand and we'll make sure that that mic comes to you. Okay, so Roger, I'm going to start with you. So what do you believe right now are the most pressing issues that you hear from the adolescents that you are serving? Is there one thing, you know, we're seeing a lot happening right now, you know, even when we think about what just happened at Parkland, Florida, you know, so are teens presenting themselves to you in any way that has been different over the past couple of years?
So I would say that the bulk of the work that I'm doing with teenagers, and I don't get like a complete sample, I only get the ones who come to see me.
Okay.
Anxiety, stress, anxiety, stress. And so I spend a lot of my time working with teenagers who are experiencing what is now clinical levels of anxiety, whether it be worry or panic, social anxiety, performance anxiety, stress.
So would you say that's on the uprise based on what you've seen?
I would say I've seen more anxiety, stress now than, and I've been at AI DuPont for 15 years, and I'm seeing more of it. Yeah, absolutely.
Tim, what's the research? Have we looked at it from a research component as to why, you know, that might be occurring?
Well, research on increasing rates of different disorders, including anxiety and other disorders like autism and even ADHD, do show some upward trends that are concerning. It's not entirely clear whether that's because there's actually more, you know, disorder in the population, or we're better at recognizing it and people are getting into treatment, which is a good thing. But it's definitely something that warrants our attention, and you know, teenagers do seem to have more on their plate now than, you know, we did a generation ago, and that may be true throughout time.
So do the two of you see that then, if, just by your comment, teenagers have more on their plate? So for all three of you, are we actually producing then this level of anxiety because of the expectations have shifted and we are requiring more from our teens than ever before? Is there an external environmental component associated with this, Frank?
I'm not sure, well, and clinically I don't know, but I mean in terms of what we're hearing, a lot of the pressure that students are saying that they are feeling is not necessarily coming from parents or teachers, it's coming from themselves or peers. And I think, especially with the connectedness on social media, people are seeing sort of a stilted view of everybody's doing great things. That's the stuff that's getting posted. And so I'm seeing people doing all these wonderful things. You know, when I was a kid, we didn't know that, you know, teenagers were doing amazing things on the other side of the world. So we didn't feel that pressure to sort of live up to that standard about starting, you know, a nonprofit or helping feed the hungry or volunteering our time or doing those kinds of things. And so, and we even see it, I think, with the pressure and anxiety with social kinds of things, this whole promposal kind of thing that you've heard about, right? So we just asked somebody to the prom if we wanted to go to the prom.
Right.
And now it's this whole sort of production. And then you've got to outdo the other. And so a lot of students are either going well above and beyond, or they're completely withdrawing from that and deciding not to go to prom and not to ask anybody because they can't meet whatever expectation they perceive. And so I think that's happening in academics. I think it's happening in sort of social interactions and other things too. So that's my sense, is that that's coming internally and from peers.
And self-imposed sometimes relative to, because sometimes what I'm seeing is I'm hearing a lot of perfectionism, right? Like just to be good is not good enough. Like you have to keep striving to be better than the next person next to you. And, you know, and if even if you're getting great grades, it still isn't good enough unless you have multiple majors, and especially for our students here at the university. What about also, you know, transitioning from, you know, being from childhood to adolescence and then to actually young adulthood? Like how early are we starting to see this level of anxiety and panic and worry?
Oh, I talk to kids who have, you know, GPAs close to 4.0 who are having panic attacks and worry because they don't think they're going to get into college because, you know, a B happened or a B plus happened. And so I think maybe there is a trend where earlier and earlier, and some of it is because, you know, are we 10 years into iPhones?
At least.
With smartphones and
Yeah.
high-speed internet, I think this is the 10th year of the iPhone. Kids have so much more information coming at them. And I think that has kind of lent itself to this kind of like high stakes, high pressure, like belief. And I think early on, and so you have middle schoolers who are just entering adolescence, and they are already like, they're freaking out about college. And I'm like, you're not in high school yet. So yeah, I think there are a number of, you know, like factors, and they're not all external. Some of them are internal, but I think adolescents are perceiving that there are these external things that they have to. You know, this idea of like well-rounded, where for most teenagers I see, well-rounded means overcommitted, overstressed, underrested. That's what well-rounded mean, and I'm like, I don't really want my kids to be well-rounded anymore.
If that's what it means,
Yeah.
right? If that's what it means. That used to mean, you know, really a good balance between a variety of things. Now even that definition has changed to what you are remarking upon. Is this resonating with you? Yes, we have, we're gonna get you the mic. Because I know it resonates with me based on what I'm seeing. Yes.
Yeah, I feel like I can remember 10 years ago when my son was going to get ready to go to the University of Delaware. And maybe 5 years before that, we heard that you couldn't have a C on your report card, or you weren't going to get into the program. You may go to the SEED program, but you weren't going to get
Directly
in.
here,
So then that caused me
Anxiety.
to have anxiety for my son, to, you know, help him to, you know, you can't just cash out here. You've got to keep those grades up. And now I read that the dean's list, the
Honors?
grade point's going to be raised because so many of the students are in the dean's list. But I'm like, why not? Because they can't even get a C in high school, so they are the upper crust students. And so it kind of is,
Perpetuating.
yeah.
Yeah.
If you're a parent that's looking out for your child, and then, you know, the well-rounded thing, you know, you want them to have every opportunity for all kinds of sports and, you know, to find exactly what their niche is, but then there's that travel teams and year-round and
The competition,
Yeah,
right?
it really
right, to
can
be the
make
best of the best. Yeah, we seem to be advancing to that, right? To be the best of the best. And as humans, we all can't be the best of the best, and that's okay. Sir, please.
How you doing? Thank you for your input. I guess when it's easy to come here with the paradigm, you're going to tell me how to fix my situation. And what I'd like to hear is how do we fix us?
You're going to fix.
Because the problem is a community problem. We have a saying in our house that bears don't dance. And what we mean by that is Disney is a fantasy. That's not life. So how do we change us as a community so that we're not constantly bombarding our kids with unrealistic expectations, damaging fantasies, and a loop that just keeps, it just grows and grows. Yeah, there's things I'd like to be able to tell my kids, but I'd also like to hear how we could come together as a community to fight back against social media, which I wish the cell phones would just all get burned.
Yeah, and you know, it's interesting when you think about the technology, the benefit of technology, but there's also that downside, which I do believe is what we're all talking about. Who would like to address that issue from, not only from this community right here before us, how do we address that relative to, you know, that fighting to be the best and the level of that stress that we are promoting, to how do we advance as a community framework to become a healthier, stronger community, because it is playing out in an unhealthy way for all of us. I would like to have the panel's thoughts on that.
We're all like, how would you like to solve the world or fix the world? I think it's continuing to have conversations as a community to talk about those things and what are those expectations. I think some of this is, and this is for everybody that's got a teenager, right? We can say lots of things and they don't necessarily hear it from us. But figuring out and showing different examples of success and what success means, and to live a balanced life, and how do you do that? I think one of the things that I certainly see in my own teens, and I think certainly in my students, is this or impetus to burn the candle at all ends, right? They're running nonstop, and we all did it in college, but certainly not to this level, because there is this constant barrage of stuff. So how do we help them figure out that balance before it gets to a point where there's some clinical issues that they're responding to, either physically, as students are getting sick, physically sick, because they've run themselves into the ground. I wish I had a perfect answer on how do we as a community come together to really figure out how to do that. But I think the more we talk about it, and this gets back to the, some of our understanding, removing stigma from these kind of responses, maybe the things that get people to talk about them more. And so maybe we need to do more of that with some of these other pieces as well, right? And not putting a stigma on this sort of overachieving piece. It's the world we live in. And I think some of that is distinctly American, in sort of that run without that sense of balance. At least that's what people externally say, right? In some places in European countries, they have a better sense of balance. They have a better sense of sort of how to connect in a community way. I'm going to stop rambling because I don't know that I have answers for.
Yeah, and Frank, I think one thing that we can do, and I think you just touched upon it, is how do we first acknowledge that it is occurring, building that awareness, and as an academic institution, we can apply research to actually show the evidence around it, and then really promote that evidence that will garner attention. Because to your point, Frank, if we look at other countries, we are an unhealthy country. We are an unhealthy state. We pay more in our health care, but yet our outcomes are very poor. This all relates to that as well. So Tim, from your perspective too, you talked about driving for evidence-based, and how do we really promote that? Do you want to kind of expand, taking into account what we're hearing tonight? Like, how can what we hear tonight then apply to, your passion relative to research, evidence-based, and then applying that into practice?
Well, I'll take the example of anxiety, since we're talking about that. There are some really good evidence-based treatments for anxiety. But what they focus on is strengthening the individual in the context of anxiety rather than eliminating the anxiety from their lives. So for example, in the case of social anxiety, one of the strongest programs is called Coping Cat, and what it does is it teaches...
It's called Coping Cat?
Coping Cat, yes.
C-A-T cat?
C-A, yeah. And it's actually for slightly younger children.
Have you ever observed cats?
They're not, yeah. It maybe needs a different mascot.
Yeah. Well, they're fairly independent.
They are independent. Exactly.
Did you say not anxious?
Not
Right.
anxious, not anything.
No.
You should be more anxious.
Yeah, they're psychopaths.
They are,
Well,
yes.
some can be.
Someone's a dog person on the pen.
But what these programs do is they say, okay, so you're terrified, for example, of talking to your teacher or meeting friends or going to a party. That's the nature of social anxiety. Instead of saying, well, wow, we should change the teacher and change the party, and we're going to say, okay, we're going to gradually teach you skills to be able to do this and to manage it, and then we're going to kind of expose you to scenarios where you strengthen those skills the same way you would if you were lifting weights or running track or something like that, so that in the end you get an adolescent or later on an adult, a young adult who's able to kind of confront the difficult world we live in.
Yeah, so they confront because there's always going to be adversity. Sometimes we don't know where it's coming from,
Right.
but then how do we build our own resilience? Because we're not born with that resilience. It actually is a skill set. So Roger, I want to ask you a question.
Sure.
Relative to your work in executive functioning.
Okay.
Because I think it's known from brain science that the brain's executive functioning isn't fully developed until the age of 25. So how does that relate then with all these external factors when we think about children and adolescents who, are just getting into that executive functioning development, and many times without executive functioning, there's a lot of impulse. Self-regulation might not be fully developed. What can we do to actually support our young people in that process as well?
So the brain is pretty amazing because what it is building through childhood is the architecture for executive functioning. And so really in those first 5 years of life, there is tremendous development of the architecture. And so even though that continues to refine and grow through our mid-20s, and adolescents certainly cannot be accused of having mature brains. Sorry, teens. The brain has wonderful capacity.
It does.
And so that's such a big question that you ask me. And so I think about executive functioning. If your executive functioning is just like all of those things that you have to do inside to make sure that you can accomplish things that have a goal or an end, while monitoring yourself, paying attention to details, checking, adjusting, being flexible, moving towards avoiding distraction. Like, how do you get your brain to do all of those things, to execute things that have like an end that you intended to do? And to me, that is the entire journey of adolescence and speaks to the role of parenting. What is my role as a parent? Because I've seen the entire kind of gamut of parenting approach for kids who don't have like strong executive functioning, from the surrogate executive functioning, which is I'm going to do everything for you, to the I know you can't swim, so I'm going to just throw you in the ocean and hope for the best because that's how my parents did it. That's how we make
Right,
people
that's
swim,
right.
just throw them in the deep ocean. And so I've seen the entire gamut of like parenting approach, like helping kids develop these like executive skills. And it is, I wish I had a simple answer, but to say, if you find yourself being the surrogate executive for your adolescent, they're going to go to college and suffer. But also, if your idea is, I must just let them sink until they learn how to swim, then you might not be providing them the amount of support that they need if they have these like deficits. And all of us have some deficits in our executive set. It's just that some of us have more than others. And so to me, this is the entire task of like guiding adolescents through this like amazing, and by amazing I mean wild and crazy time. I wish I had like a more precise or perfect answer, but I want parents to think of where are you on
that spectrum?
How much support am I going to give to my child? Because I see these teenagers who show up, and I'm sure you see them, they show up in college, but they had a surrogate all the way through high school,
right.
And the surrogate is gone, and
well, and don't we have that term now, the helicopter parent too? And you know, I mean, and it's probably coming from love, right? And really thinking about how do I guide my child into this adulthood. I know there was another question here.
I was gonna say,
can I just tie that to a point you make, and then I'll have you go back. So to the point that you made, I think we haven't societally, because you said this isn't just an individual child, an individual family problem. We haven't really figured out as a society how to like teach or instill or promote the value of failure, because everyone has to be successful, but along the way you can't fail. And so we don't know what to do with this thing, with this concept of failure, and when anxiety, talking about anxiety, I see these kids, they are completely freaked out by the prospect of failure, because how do we as a society address fail?
Well, and sometimes they think it defines them. Actually, you learn more from your failures than you do from your successes. So,
but there's nowhere in the process
but we don't
in school.
teach that.
It does not
We
from
don't teach
kindergarten
that.
through the end of graduate school or medical school, where let's talk about the value of failure, and let's
Yeah.
like.
We almost penalize people for failing, right? I know we have a couple
That whole class
comments
like
and
that.
questions here. Let's open that up. Yes, please.
So one thing that you mentioned was like around 5, you have a lot of the main structures of skills, that you're being taught, and that everything gets a little crazy in teen years. The way I look at it is that I try to remind myself is if you're working on a big project and your big paper, and at one point, or cleaning your house, at one point you have things all over the place. And that's the way the teens are right now. They have things all over the place, and they are going crazy trying to figure everything out, but they're still in the process of sorting through things.
Right.
So we have to also remember that too.
Right.
That we can help and guide a little bit. They have to figure that out a little bit by themselves.
And sometimes that's hard. That's hard for them, and it's hard for you as that parent.
So I was just curious about something. In contrast to the high-achieving, perfection kids, I've observed that a lot of our teens today post their bad behavior on social media, and this just perplexes me. This baffles me, because I thought we all tried to hide our bad behavior when we were kids, and maybe we either didn't do a very good job of it, or we just didn't have the tools to go put it on a billboard like they do now. And so I'm just wondering, is that a response to, well, I'm not going to start a nonprofit, so I may as well just post my bad behavior. Is it an executive function, immaturity? Is it a social symptom that this is the electronic age that we live in, and oh my gosh, the news is bad every day, and in a post 9/11 world, there are just awful things happening like drinking from a fire hose.
Yeah, and
So,
I know
yes,
Frank
all
has
of that.
seen this all across. How many students have you advised, Frank, since you've been here at UD?
Oh, since I've been here, it's several thousand.
Yeah.
So, and you're right. I mean, I think there is a sense, we talk about this perfectionist piece, and I think that there are, whether it's because they were sheltered, protected, or had those surrogates in there, there is a for most of our students, including some of our highest functioning students, there's a lack of risk-taking ability. The step to take any level of risk, to try something that I'm not sure I'm going to be good at, just in a lot of cases doesn't exist. And so I think there is, I have seen with some students, and again, it's an N of, maybe 24 out of those thousands, who have said exactly what you've said, which is, I know I'm not going to be valedictorian, so therefore, forget it, I'm just going to do what feels good or what's out there or whatever. I think that's rare. I don't think that that's what people are necessarily doing, although societally, a lot of the people that get a lot of attention and internet fame are not the people behaving in ways that
You would want
my
the
mom,
role
my
model.
grandma might be
Yeah.
proud of,
Or
right?
not role model
So it depends on what kind of validation you're looking for or seeking. And the old adage about, I don't care what you say about me as long as you spell my name right. At one point, my daughter, who's now 16, who would be absolutely mortified that I'm going to tell this part of the story. When we were talking about what she wanted to be, when she was small, she said that she wanted to be a ballerina who didn't go to college. And I told her that 2 things would stop that. 1, because she was going to college, and 2, because she had my motor skills. So ballerina was out of the
Is
question.
out, yeah.
As she got older, one of the things she said was she wanted to be an internet, a YouTuber. And I said, that's not a thing. And she said, actually it is, right? And so there are people who make a living as a YouTuber. And I said to her very clearly, that's not a career choice. People may fall into that. But I think there are students out there who are building brand identity, for lack of a better phrase, and they're doing it some in positive ways and some in negative ways. So it's probably a little bit of all of that. Some of it's probably impulse control and some of that executive functioning or lack of executive functioning. When we were growing up, maybe there was a Polaroid that got circulated amongst 5 people. You didn't necessarily post it on your residence hall room door, but it certainly wasn't on the internet. Now everybody has a phone. So you do something stupid, impulsive, whatever, and you're out in a public place and there's 80 people with cameras, and then this goes viral because look at this crazy guy in a suit having a meltdown, or a teacher, or any of these things that you see on the internet, and that's what's constantly coming at them. And so I think for some folks it's hard, not that they would necessarily choose to behave that way, but that's what they see a lot of, and probably more and more of. So.
I think we have a question in the back of the room, sir.
My name's Kenny Groff. I used to work here at Daimler Chrysler. This was our plant here,
It was.
and I started my children here. And they grew up knowing how to work on the assembly line, how to do work. What you got to do is go back to basics. Ask your children what they are interested in. And I'm from Lancaster County, from the Amish up there, and the Quakers. What we do is, up there, we ask the children, what would they be likely want to do? How many of you around here like animals? Practically all of you. We asked our granddaughter, what would you like to do? She was like 11 years old. She says, I'd like to have a horse. I said, well, you're going to have to go to a farm and learn how to take care of the animal, curry it, feed it, mock the stalls and stuff like that. And now she done that all through her teenage years because we kept with her, kept at her, kept pushing her. She has a quarter horse now, and she's also attending college up in New York. But the thing of it is, you got to get with your children and ask them what they're interested in and what they're doing, and support them.
So I think you bring up a great point about purpose, right? And do you feel that we as humans, if we have purpose, that we're more inclined to have that level of balance and healthy behaviors that go towards that purpose relative to where our passion may be? Roger?
I think we're both looking, right?
Are we all looking at Tim?
We're
both looking at
Tim.
Because Tim,
We'll give this one a
you have clinics, you see people from age 3 to 90,
Yeah,
right?
that's right.
So when you look at, that's a broad age range. When you look at that, who would you, like, where does the healthy behaviors come in? We're talking about, you know, where we start seeing the unhealthy behaviors, but what if we were to turn that around, as this gentleman talked about how parenting, you know, his children, like really focused on finding something that really interests that child or that even the adult, right? I mean, when we think about seniors and we think about reinventing ourselves, right? Right? Because sometimes people who retire actually end up in a similar situation. And that causes, you know, depression, sometimes isolation, addiction, unhealthy behavior, right? So where is the healthy behaviors that can intersect that would drive that? I know we're talking mostly about going from childhood to adulthood, but from your experiences with the broad population, how do we advance the healthy side?
So I think having a purpose can be profound.
Okay.
And it doesn't have to be something that necessarily is going to get the child ahead in life. If it's something that is, you know, clear, it's something that motivates them, and it's something that, you know, kind of builds skills and ideally builds some executive functioning, that can have a powerful effect. And I'm the beneficiary of that myself. When I was a teenager, I was enthralled with off-road vehicles and, you know, driving off-road. And what I wanted most was to have a Jeep or a Land Cruiser, and I was not very interested in school, nor did I get very good grades, which was much to the consternation of my parents. But my father, you know, to his credit, realized, you know, he needs to have a purpose, and so he agreed to, you know, kind of go in on this old Toyota Land Cruiser with me. And I went to this shop pretty much every day after school, kind of rebuilt it from the ground up. And that Land Cruiser did not help me get into college. It did not help me get into graduate school. It didn't help my career any, except that it kind of gave me a focus and gave me a purpose that did help accomplish all those other things. And that can be a powerful thing.
So how would you say that we can tap into that? Like, I think it's great, Tim, and I think some people, like, actually instinctively know what that passion is, right? Others do not. Like, it's almost like a blank, right? So, but you probably can find it if you spend some time. But how do we address that? How do we really? I mean, we know, Frank, students here that come to college because that's supposed to be what you're supposed to do. And, you know, that's part of going into adulthood is you have to go to college, and we kind of promote that, right? From a public health perspective, we actually know the more education you have, the longer you live. So even from an overall health perspective, it promotes that. So how do you tap in, you know, especially, like, it's great when we're little and we go, yeah, you know, this is my interest, even if it gives you something to strive for. But what about the children that it's just not quite evident?
Well, I think there's a couple things, and Tim actually brings up a point about, I think there's an assumption that, you know, we're all up here, we got to this point, everybody thinks that we were, you know, great students and did all these great things. I don't know about these guys. I certainly did not. I struggled. I was from a single parent family, first generation college student, didn't have a lot of guidance about how do you get through this. And in fact, wasn't ever really expected. Where I grew up, I wasn't expected to go to college. I went back to my 30th high school reunion, and my math teacher, who was our class advisor, came up and she said, "So it's my understanding you're a dean." And I said, "Yeah." And she said, and you have a doctorate? And I said, "Yeah." And she said, "You have a doctorate." Because at the time, I wasn't very focused on school. I was smart enough and I was bored, and there wasn't anything that was really sort of anchoring my attention. And I got into some scuffles along the way. I had a teacher in high school who gave me a line that I use constantly with students still. He pulled me aside and he said, "What are you doing here?" And I said, and I started to, and he said, no. He said, "Everything that you do and say in the world tells people something about you. So what are you doing here?" And I use that all the time with students, again, for two reasons. One, to let them know, I certainly tell them my story from time to time, so that they understand that it's not a clear path. There's not one direction. And I think part of what people see a lot is that there's an expectation that if I want to do this, I have to do these things. And there's only one way to do it. Even with the wealth of information coming, that they only see one path. And if somehow I get a bad grade or I make a mistake or I deviate from that, I'll never be able to do X or Y or Z. I'll die homeless and penniless with 1,000 cats. Like there's this whole sort of anxiety cycle. It's the cats again. There's a cat theme tonight. There's a whole sort of anxiety cycle that begins, that every mistake or every bad decision becomes insurmountable. I had a student who his first semester got a 0.8 GPA. Usually I get some gas from that. So so I've just level set for the crowd, so I know who we're talking to. All right. So he had a 0.8, and you've really got to work hard to get a 0.8. Like you have to actively go out of your way to not do things and intentionally not do things. We have a process by which students go, and anyway, his parents were there in the meeting, his mother was crying, and he leaned over to her because he was embarrassed, and he said, "Mom, stop crying." And I said, "Oh, no. You have no standing here to tell your mother not to cry. They had a plan for you, you've messed up that plan, let's talk about how you get back on track." Anyway, long story short, I told him that I was going to become his academic probation officer. He met with me periodically every other week. We got him back on track. He graduated in 4 years. The following year, when he got a 2.4 the following semester and a 3.1 the semester after that, or 3.3, excuse me, because he made the dean's list that semester. I brought him into my freshman seminar the following year, and with his permission, made him tell that story so that my freshmen would know that even if you have a horrible first semester, which quite frankly many first-year students do.
That's right.
Right?
That's indeed.
That there is a way, there are lots of ways to come back, and there are lots of paths to get to wherever. I used to work with a faculty member who was a marine biologist, and everybody thought she was this brilliant marine biologist, which she is. And when she told her tale, she was an undergraduate who got a degree in environmental science, and then she went out and she danced professionally for 4 years. She was a ballerina. And then came back to get a PhD later on. So everybody believes there's this sort of single track, that once you do that, you have to sort of continue on. And it's what Rita talked about. There's like at the airport, the people mover. Like once people, if you just stand there, the expectation is that you're just gonna sort of get sloughed along, right? You went to high school, you did okay, you should go to college. And without a conscious thought process in some of these conversations with parents, with other folks, with peers, to have conversations about what are you interested in, back to the gentleman's point, right? I talk with students a lot about what is your academic narrative? What is the story you want to tell when you get out of here? And all of our narratives evolve over the years, right? The narrative that you have now is likely not the narrative that you had 10 years ago, 15 years ago, when you were 18, right? When I was my son's age, I wanted to be a computer science major. That's what you did in the early 80s. I went to college to be a computer science major. I learned very quickly that that was not the major for me.
Yeah.
I had the sort of crisis of conscience and did what I tell students not to do, which is I selected my major alphabetically through the catalog. Art, no. Biology, no. Chemistry, no. And just sort of eliminated those things. It wasn't a very conscious choice. And it got me to some different places, but it's being ready to take advantage of those things. But understanding that failure is not fatal. And
Right.
I think it's a hard lesson because I think we feel it too.
Well,
right?
and I
We
also
feel it as
think
parents, we feel it
what's
as
important about that too is those conversations as our children are growing up. And how can we look at, and help them recognize perhaps what they're good at. Sometimes what you're good at may not be your passion, And when you think about, you know, we all go to school to end up having a career, and we spend a lot of time in our career. When you think about balance, and, you know, sometimes the career, you spend more time in your career than you are with your family. So it should be something that you are very passionate about if it's going to monopolize the time, or at least a portion of the time. I know we have another question.
My question is, and I was raised by a physician who always taught us there's someone faster, someone better.
So
But,
keep running.
yeah, but I have a freshman at UD, but I have a fourth grader. And now I feel like they are tested every other week. You're given your number. She's 9. Who gets in that group? Who gets in that group? Like, it's disgusting because they know, oh, they get small group, Mom, because they're not very smart. And I get to sit and read a book. Like, it's sad. And I hate to get upset about it, but what do you say? Yeah, you are smart and they're not. And then you worry about high school. Where are you going to get in? Like, I feel like when my son was there 10 years ago, you didn't. You did state testing and you had a nice day. That was it. Now it's spring and winter, and here's your, I mean, she comes home with a note card. This was your number before. This is your number now. She's 9. And it's a 15-minute test, and that's what we're telling her is, oh, you only went up by 10 points. Like, I mean, how do you deal with that? Like, and she has anxiety because she can't be what I guess the person next to her is. Like, and I feel bad because I don't know what to say to her.
Roger?
Yeah. And that is, it's a terrible place for a parent to be, and a terrible place for a child to be. And I remember clearly looking at my kids coming home when they were in elementary school, thinking back of my own experience. In elementary school, I was probably eating glue or like dirt or like gum from under the chair. Like, this was not my experience. And it is really, and I think even within like educational circles, particularly for elementary education, they're trying to think about the best path forward for students. And I also think that we've given just maybe societally a lot of thought about the like education achievement. And now we're starting to think more about wellness and emotional well-being. But I don't know if that has like translated well into like changing like how we're educating kids.
Even at our conference, they go over the tests and tests. And literally my husband turned to the teacher and said, is she a good friend?
Right.
Yeah, you know, and I was going to tie that to a couple of comments that were made earlier. When I'm working with adolescents, a lot of the work that we do will now involve like values exploration. And there are 2 levels that I think about that. One is just like directly when I'm working with kids, because I want to know like what do you value? What is important to you? And I thought about it when you made the question about kids posting things on social media. Sometimes in the context of having that conversation, which is a values exploration, which I encourage parents to do, I'll get kids to like acknowledge that, you know, there's some things that I have to do and some things that I value, because I would not want a 9-year-old to come close to believing that her value is tied to a score on an assessment that she spent 10 to 15 minutes on in class. And I'd really want her to get thinking about like where does your value come from? And in my adolescence, I'm thinking about what is it that you value as a human, not as a student, because when it comes to like what kind of choices am I going to be making with my adolescent brain, when it comes to like what am I going to be posting on social media, when it comes to what am I going to do when I'm feeling anxiety around like approaching this teacher? I want to have that conversation, which is a values exploration. And as I think about the role of parents, a big part of what parents are doing is I want to prepare my adolescent to enter a world where they can function, take care of themselves. And in that process, there are also some values that I would like to transmit. And so then I think about that role of guiding and the role of parenting is How do I do that? How do I transmit from one generation to the next generation the values that I hold dear? Because you're not open to have a conversation with your 9-year-old about the things that are important to you, and the things that you value, and the things that you would like to
That's
see
true.
her,
Yeah.
that the values that you want to see her like leave your home with at the end of the day. And that would be terrible to like walk around thinking that my value is somehow
my
like
test
tied into like grades or test score.
But I think I think your point is so well taken, because I think we have moved to that process. When we introduced, and I think that goes back to your community comment, that we kind of introduced the side of academic standardized testing, the value. Some teachers are held accountable for the grades that their students are making. So indeed, then that's the focus, as opposed to what Roger has highlighted. And academics are important, but this is the balance. This is the growing into becoming a healthy human being. And what happens when we go too far to the other side, we're creating unhealthy situations for children, for families, sometimes
So,
for those teachers.
A great example would be the example of play, which has been like taken out of most kids' life from preschool. And even here at the university, there's like so much great research like on the benefits and the
Physical activity.
The cognitive, the developmental, the social, the emotional, the self-regulation benefits of play. And that's been taken out of school. Like the recess is cut because they have to do
Standardized
like
testing.
more reading interventions so they can pass this test by the time they get to 3rd grade. And I'm like, kids and teens also need like veg time and downtime, but like these are really important things. Kids should play, and teens should have some downtime. It shouldn't be like this kind of downtime all the time, but they do need some time when they're not doing anything, and it's important to them.
Well, and we expect that they sit for 6 to 8 hours politely in a chair, when most of us don't do that on a daily basis, and certainly as kids with the energy that we have, right?
Yeah.
And there's no place to expend it, and certainly little boys, right, get tagged as being fidgety or ADHD, which is all real
Little
stuff,
girls
but
get
certainly
that
the
too.
energy of that, what do you do with that, and how do you expend it, and how does that play out?
Tim?
I do think, so there's all of these problems in society that I think are real issues. I also think that there is an antidote.
Okay.
And we definitely, I think, want to be active in shaping and reshaping in our communities and our societies. But I think the antidote is really the building off of what you said, Roger, the power of parents and the power of the home. If you can communicate from a young age to your child that you are loved and you are important and you are worthwhile, and no matter what anyone else tells you, you're important, that almost creates a shield for them. And there's research on this, mostly from the attachment literature, that shows that as they go out in the world and they get low scores and peers get high scores, or they strike out and their peers hit a home run, that they survive. And in fact, they flourish because they have that worth that they've taken with them from the home. And that's a powerful and I think a hopeful antidote.
Yeah, I think so too. We have another question.
I think Tim nailed it.
Oh, good, good.
What I was going to say is,
What I've learned recently, my daughter's in 4th grade as well, and I think parents have to take their own power back. The school is an entity and they're making decisions based on what their goals and objectives are, but we don't have to allow that to define what our kids take away from that. So when my daughter came home and I hear her talking about, they call it CAP at her school, it's the students who are supposed to have more potential to achieve. But she was defining it as if all those kids are smart and kids who aren't in CAP are not smart. And I said to her, you do know that not every student that's in CAP is necessarily smart, right? And she looked at me kind of funny, like, well, yeah, they have to be to get in there. And so then we broke it down and we talked about, they might be really talented in this area, or they need to be more challenged in this area, but it doesn't necessarily mean they're good at all the things that you're good at, or that you're bad at all the things that they're, good at.
everybody has different skills. It's just they're putting you where they think you're going to get the most challenge. And that changed her view on that. And I hope she goes back into the school, and when somebody else talks about it, she's able then to tell her peers, well, you can't just assume they're smarter than you at math just because they're in CAP. It just means that they need to be challenged in a different way, or they're ready for a different level of work. It doesn't mean they're smarter than you. And I think that's important. We have to have the ability to say to our kids that just because these structures exist doesn't mean that they're right. You know, they just exist because they're a school's attempt to try to give each student the right experience, not because they're trying to decide who's smart and who's not smart. And I think that's really hard because developmentally, young people, even adolescents, they don't get that.
Yeah. Well,
they
and
can't see that themselves.
Some
They can't
adults
look
don't
at it
get
and
it
break
either.
that down.
Yeah, I mean, sometimes, because I think you're giving, and I think, you know, part of what we wanted to talk are about respective resource services to support and encourage that healthy, productive adult years. So we're hearing some strategies that we can put into play, whether it be tapping into your child's passion and really providing that, you know, ability to grow in that passion, whether it be explaining to the child that this test score doesn't define who you are, and, you know, this comparing with other, easier said than done, I get it, but, you know, that comparison with the peers. But what other resources can we put into play that really advance that health and well-being? Because I think not only the stress on the children that we are raising, but the stress on the parents, grandparents, those adults that are raising them.
I think you brought up an excellent point that here are some resources. I mean, you are great resources for your children, and I'll talk about some other things. And I think back to the comment I made about values, I encourage parents to have these conversations about values, but it's tricky because if you're going to have a conversation about values with your adolescent, it actually requires a lot of listening and less speaking. But if you're going to be espousing the things that are values to you, your adolescents are such great BS detectors that if you are going to be saying, you know, like, I value balance and I value like just rolling with the punches, and you know what, I value failure, and they're looking at you like, who are you?
Yeah, no, you don't.
I've never seen any of that in you that makes me suspect that you. So it's real tricky for you, because as a parent or as a grandparent to have this conversation about values, like, adolescents their teenagers are already looking at you, and they've kind of figured out like what you value despite what you say. And so you are a great resource because you can engage them in this values discussion. And I want parents to like talk about your failures, like talk about times when you missed it, like when this was the bar and this is where and talk about like how you recover and how you manage and how you cope. Because again, if all kids are hearing is like everyone has to be perfect and we all are perfect, and if we're not perfect, we're worthless. We've got to be able to counter that. And so parents are great resources. I'm very biased. I'm a psychologist. I'm a clinical psychologist. If your child is struggling, and I love this because I've seen the stigma around like seeking help decrease over the years that I've been practicing. Mm-hmm. Your child used to be that the question of, will someone think my child is crazy if I take them to seek help? And I'm like, no, I do everything from like treatment of severe like mental illness to like guidance for kids who don't really have to see me, but it's helpful to have like another person that they can like just throw their thoughts at, and we can pull in the parents as needed and just talk together. And so by all means, seek out. Schools have wellness centers.
Yes.
I work at AI.
Roger.
I work at AI. Harder to do. But I do a lot of assessments. I mean, but through like even at AI, we have lots of resources, and we have a plan to hire 75 psychologists in the next 5 years.
Because we also know the value of behavioral health, right? I mean, many times we've really accepted the value of physical health, but we kind of, as Roger indicated, frowned upon going for behavioral health, that we thought it was some sort of a character flaw or something, wrong with us. Not perfect. Again, with that, we're just getting to the point, in fact, we're striving to integrate behavioral health with primary care so people can get assessed sooner and get supported sooner, because think of how you feel when you're having these behavioral health issues come before you. It's increasing the anxiety for the entire family, and that's not good health. So we want to be able to provide those resources to promote good health and well-being.
And I was going to say, and we live in anxious times. There is a reality to that. There is. I will say, when the election happened, my, at the time, daughter, who was 15, came down and she was inconsolable the next day. She has GLBT friends, she has trans friends, like that she was convinced that the end of the world was upon us. And there is a reality to that. Now we're living in a nuclear, there are anxieties out there. So I don't want to, I think we can respond, and exactly in having these conversations, acknowledging that these things are there, acknowledging our own flaws and struggles, but to really look at the behavioral health pieces. I talk about it a lot with my own family as well as my students about, we talk about exercise, we talk about eating well, but we have to talk about, mindfulness and meditation and getting a massage and physically taking care of ourselves. That also helps us mentally, spiritually, emotionally.
And eating the right foods.
Absolutely, and sleep. What we see certainly with teenagers and probably everybody in this room.
Sleep's huge.
Right? And I won't do normally I would say how many people have, slept 7 to 8 hours last night. Mm-hmm. You don't have to put your hands up, it's rhetorical. And really slept. But it's very few people. When you get into, teenagers with this, again, constant barrage, and it's the anxiety of the last thing I see before I go to bed is my cell phone and my social media, and the first thing I see when I get up in the morning. When I went home, again, Bick, when I was their age, I came home, there was a certain sanctuary to it. I could leave all that. The kid who picked on me at school was at school. It wasn't happening there. Now it's sort of constant. And so trying to figure out how to help people disconnect from that, how to have a context for that, how to not tag your self-worth to that. And again, demonstrating that ourselves, right? We all care about what people think about us or what our neighbor, there's all of that going on in the world too.
And Frank, I want to get back to this gentleman's
I don't mean to be so doom
issue also about the community.
I'm a happy guy.
Because we did have one of our conversations in healthcare was also about how do we turn that off, and what can employers do relative to that, because we seem to have transitioned, largely because of technology, into a world where we're always on. And our children have picked up on that too. And that's why you see what you do. So how do we, getting back to your point about as communities, how do we promote healthy communities? Some employers and workplaces are actually promoting that you're not always on for their workers, because they're starting to recognize they might have thought that was increasing productivity because they were always their employees were always available, but actually it's decreasing productivity and it's causing unhealthy behaviors. So, how could we as an academic institution do our research in a way that it really does promote, workplace wellness by addressing those issues, or the research relative to resilience, not only in times of tremendous trauma, but just in our day-to-day life, because we know adversity is ever going to be present. When I think about, adversity has always been there, right? Even for the generations that have come before us, but they just didn't have this much information coming at all times across the world about all the adversity that may be occurring, all the tragedies that are occurring. And we're absorbing all that, and so are our children. So how do we do that balance?
And I forgot one point.
Yes, please.
Your pediatrician. Use your pediatrician as a good resource. When I think about resources, if you don't know where to go to your pediatrician and make that their problem, because they will help you figure out where to go, like whatever it is related to your adolescent.
Ryan?
I just wanted to point out, working here for employee health and well-being, we do see a lot of parents coming in and they have questions about this and they're anxious and they're stressed about their kids being anxious and stressed. And a lot of times, I feel like a lot of it is they just need to look in the mirror a little bit too, that where are your children learning these behaviors from? So instead of us always fixating on, I need to fix my kid, where do you think they're learning that from? So are they only listening to you complain about work? Are they only listening to you fight with your spouse? Are they only listening to you watch all the negative news? Or do they also hear you say, you know, I had a great day at work, or let's go for a walk together? Or are they hearing that positive as well? So I know at least here we do try to focus on that a little bit as well. So looking at, you know, to your point about resources, I think parents just being a little introspective and self-reflective and understanding that you are stressed and anxious as well, and that may be contributing to their stress and anxiety. Put your own phone down, you know, go for a walk yourself. All of those habits you're trying to teach them, make sure you're doing as well. So they're seeing it and they're seeing the positive benefits and seeing that it works.
Well, and level set for people too. So we and people have heard me tell this story. So in the storm last Friday, our power went out at 3 in the afternoon. Delmarva said it wasn't going to come on until Monday night at 11. Right, so there was all kinds of like in the house. We stayed in the house that night. It was freezing cold the next morning when we got up, and my daughter and the people were complaining about, you know, and I said, you know, Puerto Rico's been without power for months. Like, let's keep a context on this as well, right? And that we're able to do that. And so we're able to read by lantern light. And we did some things that were a little sort of, you know, rustic settler kind of things. And it was a sort of quiet down, introspective time. So trying to use those things and switch that from, oh my God, we're going to lose all the stuff in the freezer, which we did. But you know what I mean? Like you can get that all ratcheted up.
But you weren't worried about powering up.
Or
you weren't worried about powering up.
Right. I
Yeah,
mean,
you worried about the real basics, not
Right.
where am I going to plug in my iPhone?
In the car.
Well, we were worried about that too, but that's right. And the portable charger and the, right, exactly.
To my point.
That's right. That's right.
I think we have this gentleman, and then we'll come back to you, and we're almost getting to the hour.
I'm a proud grandfather, and my grandsons is 11, and one's 11, one's 8. I was really proud of it. My 11-year-old, he's a junk monkey, and I call him that, because he's all the time in the junk, repairing things, finding things, and fixing them up. And one here about 6 months ago, he was out walking in the woods. He said to his dad, there's a Mustang out there in the woods. And Dad thought it was a Mustang horse. He said, no, Dad, it's a Mustang, don't have an engine in it. They had to go out, cut the tree off, pull the Mustang out. They took it back home. They're working on getting a title. The young boy, he's only 11 years old. Now he's working on an engine, and he's rebuilding the engine. I heard that he's going to put it in his car and everything, and I was really impressed.
Yeah, that's great.
And that's the thing of parents working with their children, understanding what their children are talking about, and do what their children want them to do, because their children is learning by what they're doing. And the other boy, he's 8 years old, and they tell me he's a dynamite in soccer playing. He's good with field goalies, and his parents goes with him to the schools. After school, Saturdays, they do soccer playing at different schools around. And somebody that was on WGAL television wanted to pay my daughter and her husband to have him go to other schools to be the goalie there. And they wouldn't let him do it because there's so much involvement of getting hurt and stuff like that.
Sure.
But they're involved with the children.
That's right.
And that's what you got to do, get involved with the children. Yeah. And I taught my children as we were growing up how to do things, get involved, and we watched them, we go places with them, and our children turned out to be great. My daughter works at Lancaster General Hospital. She's a receptionist. My son-in-law, he works for Johnson & Johnson, and he was a young teenager too. It didn't have a guidancy. But when he got with us, and I worked here at Chrysler, He didn't want to come and work at Chrysler. He wanted to venture on to do what he wanted to do.
Well, and
so
I think
we supported him.
And I think that's the key. When you find out, I think for all your children, they kind of had a passion, and you tapped that passion and you supported that together as a family. And I do believe that you're reaping the benefits from that they'll carry with them for the rest of their lives. And sir, for you.
I just wanted to sort of, picking up on what this gentleman was saying, I think one of the things that we have to do as a community, and I'm going to get back to that in just a moment, is instill a different paradigm of success. A, paramount. B, that in this paradigm, I think one of the most important things I can do as a parent is try to help a child or a friend keep a sense of wonder in their life.
Sense of wonder, yeah.
Where there's curiosity, there is wonder.
Yes.
And I could go on and on, but I mean, I think to come back to the community aspect of it, we can't do this if we're isolated from one another. It's the old saying, the village raises the child, and what's missing primarily in today's world is the village. We live in our fences. Don't come in my fence. You know, don't come over and shake my hand. You want to come in? You're a Republican. I can't have you over. I'm a Democrat. I'm a progressive liberal. You're the enemy. We have to stop this.
Yeah,
and we're the ones that have to stop it. You know, and I don't know all the answers, but I know that if we don't start talking to one another, then it's not going to bode well for us. So, you know, I have to keep my sense of wonder, and I need everybody in here. Things I've heard tonight is like, wow, that's a good point. You know. I just wanted to.
Thank you. And we need to be open to that too,
Yes.
right? But I love that. I love, so I'm going to have each panel just quickly, what's your final statement, short final statement?
Sure.
Roger.
I like to tell teens and parents, I tell parents, your child will become who they become, partly because of you and partly despite you.
That's right.
And so, hang in there, do your best. Your job is to prepare them to face the world, but really think about instilling values. Think about what are the values that I would like my child to go into the world with, because if the only value that kids observe is achieve, accomplish, then I think in terms of being whole human beings and well human beings, we've lost a lot.
Yep.
So,
Tim, final statement?
I think as we've talked about, our teens and young adults face a tremendous amount of stress. I think this can be a problem, but I also think they're up to the task. I think they can do things that are really remarkable. And if we believe in them and if we empower them, if we give them that kind of shield of worth, self-worth, that they'll get through it. And they're going to make mistakes, they're going to fail, and we need to make failure okay. And then they're going to end up basically changing society the way we hope to. I mean, we're not going to have much of an impact on society the way it is, but they will. Yep. And if we can instill those values in them, give them that shield, I think they'll do amazing things.
Thank you, Tim. And Frank?
I would ditto all of that and say, one of the things that, and we started early on talking about Parkland and some of the anxiety from there, the thing that gives me hope is the response of the kids in the community in Parkland that have now mobilized and motivated to make some of those changes that have avoided things in the past. And so it feels a little different to me in that regard. But I think one of the things that I've learned, it was hard working at an institution for 30 years or whatever, and then having children, right, who then became teenagers, and I started to talk to them in my sort of, here's how and to understand that what I had to do was do a lot of listening and really understand that while what they said, it was very easy for me to go, well, you don't have to worry about that because, 5 years from now or, time's the great equalizer, it's real and impactful for them. And so to hear that and really help them sort through, what does it mean? How do I deal with it? What's the response? What is it really underneath there? One of the things that I found recently, so certainly doing lots of reading, there's lots of great books out there about raising teenage boys, raising teenage girls, understanding introverts, which I am not. So it's really hard for me to understand the mind of the introvert. But then start to use some social media pieces to help them start to organize and be mindful. There are some apps and things out there so you can sort of turn their technology against them, right, to help them be more mindful, be more relaxing, really start to focus in ways and use that technology to help switch some of that around. So I think it's just communication, right? It's continuing to have these conversations, to have conversations with your family and one another, and finding those resources for yourself as well.
And we appreciate you being part of our conversation here tonight. I would like us all to give a round of applause for our great panel. And want to remind you that the next conversation in healthcare is on April the 26th. It will be here, and it's titled From Stable to Flourishing, Redefining Good Health. Hope you join us for that one as well. Thank you for coming out. Please help yourself to the food and water.